It is impossible to find anyone who has not been directly or indirectly touched by the economic calamity that occurred. The list of personal and community impacts is long. 4 million jobs lost, plunging families into a severe economic crisis. The mortgage lending crisis leading to massive home foreclosures and the tightening of credit.
The foreclosure crisis has had an enormous impact on people throughout the city of Los Angeles, and we should be doing much more to make sure the rules of the game are fair so that homeowners aren't taken advantage of.
Personal bankruptcies soar. Cash-strapped government agencies slashing services to poor and middle-class families. Increasing income and earning gaps between rich and poor individuals and families. More men, women, and children relying on food stamps and food banks to meet basic family food needs. The list goes on. With each of these economic problems and harsh social circumstances, the health of our collective community is affected.
Even the Department of Labor says that 1 in 7 jobs over the next 9 years is going to be a healthcare job. So this crisis has given us the opportunity to think about how do we make those jobs good jobs? How are we creating opportunities in communities where unemployment is on the rise and healthcare disparities exist, and put those two things together to create a system whereby people can get quality care and our community members can have quality jobs.
Unemployment workers feel increased stress. Former breadwinners fight debt collectors and depression. Many individuals lost health care coverage and now can't afford to see the doctor or dentist or pay for prescription medications they need.
So I'm really hoping that throughout your dialogue and days of dialogue, we can begin to not only coalition build, but to train advocates around communicating their public policy needs to their elected officials, and in fact identify some candidates who will bring that policy perspective to the state legislature in Sacramento.
We need to reflect on what we've been through. We need to talk seriously about what we need to do to rebuild our economically fractured communities, to make them healthier and more prosperous. Why have a day of dialogue?
The economic crisis in our community health is so important to all of us right now. This is really a transitional time in the history of our country. And while we may not know the precise next steps to take, we can explore what those steps can be so that they can be constructive ones for both ourselves and our community at large. Certainly, our policymakers should know the issues that concern us, and we can take steps to improve our situation one step at a time. Dialogue is the first of those steps.
That is our challenge today, to sit down with one another to have an authentic and respectful conversation about our status, condition, and mindset that we hope is an end to a great recession.
And there is no democracy as we know it without a vibrant center. You've got to have a middle class. You have to have a place for people to move up and through.
So it's about getting people working, and including especially our young people. Those that have said that they're going to do the right thing and have gone to school, they deserve when they come out to be able to find a viable job for them, and we got to make sure that happens.
Our dialogue conversation will reflect questions people ask themselves when their lives get thrown off track and they want to find a way out of a difficult and confusing situation. Who are we? Where are we? How did we get here? How do we move forward? The discussion guide and your facilitator will give guidance for this conversation, but let's go introduce these briefly. Phase 1. Who are we? We will briefly introduce ourselves to each other and discuss the ground rules we need to have a good conversation. Phase 2. Where are we? As you discuss this question, we encourage you to think about health broadly. Health means not just how we are doing physically, but also how we are doing psychologically, emotionally, spiritually, and in terms of our relationships with each other and the environment. Phase 3. We will explore the question, how did we get here? Here we will talk about the decisions and actions people took as individuals in community-based organizations and in large institutions to create the problems we have that worsened our economic situation and community health. Phase 4. We will discuss what needs to happen now. Here the key question is, given where we are, what are the most important changes we need to see to build a healthy community? This may be a chance to see if there is anything you or your conversation partners may want to personally do to help create more community health.
Dialogue doesn't require that people agree, and it encourages people to understand others before they seek to be understood. And so we're able to help one another to understand different points of view in ways that we don't otherwise when we're talking about issues in controversy.
At the end of the discussion today, you will have a chance to fill out a short evaluation. The Days of Dialogue group thanks you for giving us your feedback about how to make these events even better. Most important, we thank you for your open mind and your willingness to talk about tough issues in a civil way with your neighbors.